The next cranial nerve that will be tested is your facial nerve. To do this, you can just look at your partner's face, make sure there's no drooping or any kind of remarkable asymmetry, and then they will make a series of facial movements. They will raise their eyebrows, shut their eyes tightly, smile. Make sure these folds, which are called your nasolabial folds, are the same. You can frown and show the teeth, puff out your cheeks. The point is to make sure that you have symmetry, that both sides are doing roughly the same thing. Our next test is going to test cranial nerve 8, which is your vestibulocochlear nerve. And I don't have a tuning fork, so I'm just going to use one of my forks and pretend. So you hit it, and you hold it to this part of your partner's skull, the mastoid process. When your partner stops hearing it, attach the mastoid process, you move it to their ear and ask if they can hear it. Normal function is that they can. This next test will also test the vestibulocochlear nerve. You have your tuning fork again. You strike it and put it directly on the patient's forehead to make sure that they can hear it with both ears equally. The next series of tests will test the function of both cranial nerve 9, which is your glossopharyngeal, and cranial nerve 10, which is your vagus nerve. So what you do, you would just observe the patient or your partner swallowing to make sure you see a normal movement. Nothing's going to the side or doing anything funky. You can also look at the uvula, which is the little dangly thing in the back of their throat, to make sure that it is roughly in the center of their throat. It's not deviating to one side or another. The next series of tests will test your accessory nerve, which is cranial nerve 11. You can observe the patient's trapezius muscle, make sure that there's no atrophy, have them shrug their shoulders. If they're able to do it roughly equally, that is a good sign. Also, put a hand against their face and put a slight resistance to it and have them turn their head. And try to watch this muscle, which is the sternocleidomastoid, to make sure there's no atrophy or any obvious deformities with it. The last nerve that we're going to be testing is cranial nerve 12, which is your hypoglossal. In order to do that, you basically have your partner stick out their tongue. There's no obvious wasting away or atrophy of it, and also it's once again roughly down the center of their face. If there was an injury to that nerve, it would actually deviate to the side that was injured.